Dr. Jones authored much of the report. This confirms my belief in unknown, undiagnosed condition. This is in black and white in the paper record. Another thing, since he was doing the records this time, these records are very elaborate, at least in print. They went to great detail in the documentation process. I obtained my new CT and written records shortly thereafter. The CT record has been clearly edited to make them hard to view. Despite a more refined scanning process, these images are lower quality than my original CT scan for 4 months prior that were without contrast. There are fewer series of images in the contrast, and the brightness and contrast has been manipulated in these newer CT pictures to hide details. They are hard to look at. You look at these pictures versus the old ones, you will see exactly what I'm talking about. The injury area appears, despite these edits, broken bone is visible. And guess what? In these new pictures, you can see worms, big ones, like 3 or 4 inches long, in my neck. Possibly tapeworms, nematodes, flatworms, hookworms, pinworms, some kind of parasite worms are in there, maybe something exotic. So despite the fact that I'd been to this same emergency room a year before, August 2018, with an x-ray in the cervical area, I'd been there in April on the 22nd for a CT scan without contrast. And then now I was there for a CT scan with contrast. They had 2 doctors who looked at these CT scans with contrast, and they were not able to see anything. However, there are 3 major items that show up in these pictures that were overlooked. And the main 3 problems that I had that brought me into the emergency room this evening. The first thing you can see is there's a 3-inch long worm back behind my neck. Second thing is there's a quarter diameter sized eggplant on the left side of my neck, which is about as long as my ear. This is some kind of parasite nest or an infection tumor. That's what I believe. This thing finally burst one night. And the next thing that brought me in was the fact that this is like the main cause of these other problems. It's my broken skull. And the way they messed with the contrast and the brightness with these pictures this time around, this is hard to see. You can still see some bone that's broken up, but it's very bright in that area. And there are techniques that they used, which are different than were used in the other scan. They make it kind of hard to notice that my skull is broken.